Greetings from the Health and Beyond group. We are back today with a new episode on emerging infectious diseases and the One Health program. I'm Dr. Shanta Misra, your host for today's session. Emerging infectious diseases, or EIDs, are diseases that are newly identified or have recently increased in incidence. Some examples of these are Ebola, Zika, Nipah, more recently COVID-19, H5N1 or bird flu, HMPV. Many of these diseases are zoonotic, meaning they can be transmitted between animals and humans. Since many are zoonotic, WHO came up with the concept of One Health. One Health emphasizes the interconnectedness of human, animal, and environmental health. It's an integrated approach that recognizes that the health of people is closely linked to the health of animals and our shared environment. Today, we have with us two esteemed experts, Dr. Shanta Misra and Dr. Dipanjan Roy, who will be our guests for this webinar panel discussion. Dr. Shanta Misra is a senior tropical infectious diseases and public health expert with around 30 years of national and international experience. Dr. Dipanjan Roy is a senior public health professional with more than 3 decades of experience in health systems and emergencies, HIV, AIDS, TB, vaccine preventable diseases, and public health medicine. He has worked with CDC, WHO, the World Bank, and others in many countries, including India, Timor-Leste, Indonesia, and many African countries. Dr. Misra, what are the reasons for these new emerging infections?
Thank you very much for having me on the show. I also would like to extend my welcome to Dr. Dipanjan, who is my co-panelist today. As you rightly pointed out, emerging infectious diseases mostly are zoonotic in nature. That is, they spread from animals to human beings. Now, that explains that when we come in close proximity and over the recent times, we have come in close proximity with animals, whether it is domestic animals, wildlife animals. So the human habitat is encroaching into the animal space, and animals are also coming in close proximity to human beings. So that has made transmission of these infections, which were not so frequent in the past, becoming a little more predominant. The second thing is with environmental factors like deforestation, etc. The nature of the animals and the vectors have also changed. We have vectors causing all the vector-borne diseases, malaria, dengue, chikungunya. So they are also kind of a little more widespread now because again they have entered into human habitation. The third thing which I would put it into this perspective was of global travel. Infections which were remaining isolated in certain geographies in certain parts of the world. Now, with frequent international travel and frequent mixing and of people across continents, the transmission of these infections have been a little more widespread, a little more easy from one country to other. So these are some of the reasons why we have, or rather we are seeing more of these infections, which are called emerging infections, which are either new variants or infections from the past.
What about the specific challenges that India faces regarding these emerging infections? What would you, in your opinion, feel that we need to address them? What are the challenges?
Okay, one challenge may not be for India, it's for across the continent, is that most of these pathogens are variants and they remain a little unknown. We might be having some vaccines or some knowledge about a kind of a infection or infectious agent, whether it's a bacteria, virus, but with mutations, it's a totally whole new story altogether. So we need to study that a bit. Second thing is with this rapid spread across, we have very little time before these kind of infections in large numbers affect our populations. So we really our turnaround time of having these infections and responding to it is very short. So in that period, before we can really come to terms with an infection or do some kind of a management or some kind of a prevention. The third thing which I would point is that even if we are tackling existing infections through some medicines, vaccines, etc., a lot of these vectors are also getting resistant to the usual things, particularly the all kinds of mosquitoes, whether it's Anopheles, whether it is carrying all chikungunya, dengue, malaria. So once we come to terms of on the process of elimination or eradication, then a new variant or a resistant variant comes, which is resistant to medicines or resistant to your insecticides. So that's another challenge that comes up. The third thing, which I think is also very important, if not more, is the use of the antibiotic resistant rather to the bacteria, which has caused a superbug to come up into the open. Now these superbugs are mostly antibiotic resistant organisms. So that becomes a challenge because of this misuse or overuse of antibiotic or unregulated use of antibiotics. These are some of the challenges which, as I said, not necessarily in India, but it's across the globe. Like many countries would face when we try to control these emerging new infections.
What precautions can general public take, like the Aam Aadmi, what can he do to protect himself from these kind of infections?
Yes. We can discuss a bit more on this. Of course, the One Health program will be elaborately discussed by my colleague Dr. Dipanjan, what the program can do and how the people can respond. But in a general kind of a message or general kind of awareness to the communities at large, is that we need to be alert and continue with our hygienic practices. We saw that during the COVID pandemic, where we are supposed to always wash our hands, keep ourselves clean, keep our environment clean. But with this COVID pandemic, it reinforced. So these things outside of any pandemics needs to be practiced by everybody. Hand washing, cough hygiene, respiratory hygiene. Those things should be part and parcel of your day-to-day life, not necessarily wait for an infection to emerge, etc. So that's very important. The second thing is public awareness about being a little alert about what these infections can do or when they can come up. Very recently, we came across this HMPV, which was earlier this year or late last year, broke out. There was a huge panic because everybody compared it with COVID, since it also started, the initial reports were from China. But the government of India and the government and various other stakeholders took up this awareness through their TV channel, through announcements, through press, that not to panic. What are the steps that needs to be to control? I had also participated on the podcast where I also spread awareness that there's no need to panic. It's better to be alert and aware and take precautions rather than just panic. So these are certain things, and of course, I would really appeal to our friends and colleagues, both and the veterinary science side and also in our medical clinical science, to moderate or regulate the use of antibiotics, because that already antimicrobial resistance and the cause of these resistant organisms are already a reality and a very alarming reality. So that's the other thing which we need to be aware of and keep track of how and where antibiotic resistance appears and how to manage and tackle with it. And of course, we also recently, if you come across, we have come across, of course, may not be an emerging infection, but we have come across a lot of dog bites and rabies cases. Now, well, we know all the stray dogs, etc., should be vaccinated against rabies, but I think that more needs to be done because obviously all dogs are not vaccinated. Second thing, people who come across a dog bite should immediately go and report to the health center and get themselves vaccinated with not only ARV but also with the immunoglobulin, which the attending doctor can decide on this. And also keep an update yourself with your family physician of what are the vaccines that are required. Even adult vaccines are required, boosters to be required. So these are certain awareness and things which the general community should be aware beyond any pandemic or epidemic. So these are some of the suggestions which I would like to communicate to our viewers.
Thank you, Dr. Misra. We realize the importance of animal health and environment and the link with human health that are key factors to consider when designing and implementing public health programs to address emerging infectious diseases. It is important for the community in general to contribute their efforts and support all government initiatives in taking care of their own hygiene, the environment, and animal health when required. Coming Coming to the One Health approach, this aims to address the challenges of emerging infectious diseases by promoting collaboration across various sectors, including public health, veterinary science, veterinary medicine, and environmental science. It recognizes that the health of humans, domestic and wild animals, plants, and the wider environment are closely linked and interdependent. Dr. Roy, how does the One Health approach address the interconnectedness of human, animal, and environmental health? This is a new concept. Many of our viewers have never heard of it. So, can you please elaborate?
Audio on. Yes, thank you. First of all, thank you very much, Dr. Shanta, for introducing us. And it's a real pleasure to be on the show. And thank you, Dr. Misra, to be my co-panelist. And I think you've really elaborated nicely. So answering your question, let me start off by giving a little approach on what is One Health to our viewers. You were rightly pointed out, we use the term, primarily it came more from the COVID side because the general public population or general public was very much unaware. It just came from there. But what is it? Let's understand it very critically. It's not only that human health is one part, we have animal health and the environmental health. You have these three. So the interconnectedness of this, one of the pathogens from animals can travel to the humans or vice versa, and also using the environmental issues. And that is the critical approach of One Health. And our approach to addressing these, especially the new emerging diseases and the diseases which could be from the zoonotic origin, any of these animal diseases can be transmitted to humans by simple mutations or some environmental changes which may take place. So all of these are classic examples of how zoonotic diseases, so-called the diseases which are in animals, have been transmitted to humans and has caused some kind of outbreaks or epidemics or pandemics in that nature. So the interconnectedness is there. See, the nature does not separate. It's us, we say, okay, this is A, humans, this is B, animals, this is, separate environment. The nature has not made any such distinctions. Things are free to go from here to there if there is a favorable condition or the environmental health part of it. Now, One Health approach, we use that to address this as a holistic approach, not look at one disease per se for humans, animals, or something with environment. We look at it a holistic way so that the approach can be more comprehensive and can be much more towards going to the roots and taking it out. So that is very important, and it includes not only just the medical professionals, it includes public health, obviously, the veterinary medicine, the animal medicine, the environmental science, we have agriculture, and do not forget the wildlife. So it's a comprehensive approach. By fostering this interdisciplinary partnerships, we are able to provide that approach. It's still in much more nascent stage as compared to many things. And I would just like to emphasize it is coming up, and I'm sure with such emerging threats, things would improve day by day. So in conclusion, I just wanted to add simple things for our viewers to understand that One Health approach provides a framework of addressing the complex and interconnected challenges of emerging infectious diseases, especially the communicable diseases. And we have to be cognizant that there is interdependence of animal, human, and environmental health, and we must promote the interdisciplinary collaboration. In other words, quote, One Health approach. Thank you.
And what are the challenges that this One Health approach is facing? Like, how do we implement them? And do we have any specific needs or issues that we have that are specific to our country?
That's an excellent question. As with anything which starts off, One Health approach, excellent in theory, When you start
Yeah,
off doing the practicals,
it is.
you are getting veterinarians to come and have the same floor as the medical personnel, also the environmental scientist, also the wildlife specialist,
Right.
and everybody speaks a different language. First of all,
Yes.
that is the intersectoral collaboration that becomes a
Yes.
major challenge. It's easier
True.
said than done. People
True.
may not be able to appreciate the other person's uh,
Point of
perspective,
view. Yeah.
point of view, perspective, and other aspects. So it becomes a very difficult aspect. So the first of the major challenges we face all the time is how to get these all the people working together for a
Wow.
unified common goal. That's one. Then, of course, since it's a relatively new thing, and the second most important challenge which we see is the resource allocation. And of course, the other part is for any emerging infectious diseases or any communicable diseases, surveillance or tracking what is happening is very important. Now, how do we track animal diseases? Half
Yes,
the things we don't
very
have. We
true.
don't have the resources. So surveillance and monitoring and environmental health goes for a six. So it's bound to happen that the surveillance monitoring suffers, and many reasons of this. And of course, the same thing has happened thanks to COVID. The public awareness and engagement has become much better and this, but this has been a major challenge. So these are some of the few challenges, and I would just like to, since you asked for India, the some of the things which I can think of offhand and quickly is the zoonotic disease surveillance in India is very weak. Obviously, it is the diverse ecosystem and others.
Mhm.
Urbanization, land use, environmental, as the climate changes which is happening.
Yes,
I'm
of
sure the
course.
people who live in Delhi can address this very well with the kind of air pollution to having more of heat adverse effects, more of this global warming, whatever it could be. And it's all about environmental health in general. So urbanization, rapid urbanization, not only urbanization. So these are some of the specific challenges, land use, etc. The agricultural practices. We are uh, going away from a lot of the traditional agricultural practices to more high yield with very finely put in. Implementation is patchy, but yes, we are getting there. But the capacity building and the capacity to implement this has been a major challenge. So that's I can say about some of the major challenges, which is globally we are saying, as well as some which are very specific to the India in this context.
Just to add one thing, I think after the COVID pandemic, while we still struggle with the environment, animal health, I think the public health preparedness has improved post the pandemic across India or other countries. I'm not sure. What would you say to that?
Oh, yes. Thank you very much for bringing that point, Dr. Mishra. You know, uh, I think COVID has really improved the public health awareness. And not only the public health awareness, but also the public health demand. That demand itself is going to make a lot of difference. So if everything was strengthened during this COVID, not
COVID.
because it was supposed to be done so, but because of the demand from the grassroots levels. Once the population demands, things will happen. And I think that is where I would really say public health got a lot of fillip. And along with the public health, the other thing which was built up was some of the public health infrastructure, which was long, long, long overdue. You had lovely tertiary care hospitals being built up all across private sector, even public health, public sector or the trust sector, but you never had investment to this nature in primary health care. So, which in turns enhances all the public health approach. So, I think that's been a very good area. Thank you.
So, Dr. Roy, you have talked about the challenges that One Health initiative faces. And you said that it's the demand of people, and that's actually the true essence of a democracy. When people demand something or want something, the government obviously, enforces or implements. So, what about, do we have some success stories just to, and on a positive note, on in any different countries or regions that you can think of, because you have a very good international experience. I mean, you
Thank
worked for 30 years, more than 30
yes.
years.
Yeah, more than 50 countries
Oh
precisely.
my
Thank
God.
you very much, Coach Kush. Yes, that's an excellent one. And remember, it's always uh, any health or any hope, it's hope. We
Yeah,
must
it's
have
so.
positive. If we do
Absolutely.
not have positive examples, how are we going to do? If everything is
Ex-
negative, it doesn't work. So there are plenty of good examples.
Oh,
I'm
okay.
very happy to share some
That's
of them.
really nice.
And if you look at Dr. Samarendra Mishra just brought out the rabies one, one of the zoonotic diseases which has and
Yes.
others. So one of the most important which comes to my mind where the rabies elimination took place from a country which was in Tanzania. They were really reeling around with rabies control and this one health approach typically, and it's being quoted in WHO's even repository and repertoires about the controlling rabies by integrating human and veterinary health sciences. That's one of the really good public health education, mass dog vaccinations which took place, and also awareness and the human. It's like community-led awareness control and everything else. Then avian influenza. I'm sure many of us during the 2000 to 2010 had this context of avian influenza, especially H1N1, which is P9 as they say. In 2009, we had this avian influenza pandemic across, which was there. Vietnam, it's got one of the good public health infrastructures, and they were there. So they adopted a very good One Health strategy and were able to, take care of their own avian influenza cases, and plus also the other countries and others, and it did not spread much. Developed countries have lots of good examples, and like zoonotic disease surveillance in the United States is one of the real good ones, and the CDC, Centers for Disease Control and Prevention, I have worked for some period of time, also had this lovely zoonotic disease surveillance and includes partnership between veterinary and the environmental health agencies, the OSHA Occupational Health Agency, as well as the Environmental Health Agency, plus the veterinary sciences and the public health agency, all putting together as a single surveillance tool, which is a zoonotic disease surveillance. So that's one of the good examples. Uh, I think one of the good things brought out by Dr. Mishra also was about the antimicrobial resistance. So when we talk about AMR, and if you look at Europe, the regulations, the way, and everything else which has taken place in Europe has really brought down the rates of AMR in Europe.
Okay.
Unfortunately, in our country, especially in India and the subcontinent, and especially the developing countries, we are still far away from it because over the counter we are able to get antibiotics without even valid prescription at many times. Especially, a lot of this antibiotics are also used in veterinary sciences. For
Yes.
example, in the chicken farming, you're using it in beef
Dairy.
cultures, the dairies and everything else. So it keeps on happening. So this is the regulated use has been very and a very, I would not only say a regulated, I would say a responsible use of antibiotics has been an excellent approach in there. And Ebola outbreak in West Africa. Some of these have been excellent examples. Ebola, especially in Liberia and Sierra Leone, the country. I was in Sierra Leone when this outbreak took place, part of CDC's team, and I did see with my own eyes and think that how all the veterinarians and others, especially environmental, whoever was available, precisely. It's nothing because it was ultimately an emergency with lot, and also the. So these are some of the good examples I can share from it. In India,
We
Nipah
do.
virus control, especially in West Bengal and also in Kerala, we had this lovely One Health approach with full interdisciplinary team working day in, day out to control the
Yes.
thing. So we are getting there in this context.
Yes, of
Thank you.
course. So finally, any suggestions for our programs? Like you have already suggested, given many suggestions, engaging in animal health and climate change. And these two obviously require equal attention, if not more. So that is our final question. So what would be your suggestions?
Uh, an exit one, and let me give some broad overviews rather than giving very specific pointed suggestions. For animal health, I think
Mhm.
this is where I would put my bang for the buck, as they say.
Mhm.
The enhanced surveillance and monitoring. The surveillance in animal health is important. Currently, we have some level of surveillance. Need to do is not to depend on media for our surveillance. where a
course.
media gives us, that, okay,
Yeah.
there are 10 cases of
Oh, okay.
cats died, or
Okay.
some dogs have bitten somebody, and then the health team rushes there and gets it. So we should
Absolutely.
have some this thing. In the animal sector also, we have veterinary people at most
Of
of the
course.
districts and other
Yes.
places. It's just a matter of getting them under the network. That's awareness at the policy making level, and the policy makers level in that context would be an important area. So that will help out in enhanced surveillance. Uh, Veterinary infrastructure would need a lot of help. So because it
Well, we
is,
have this Vantara now coming up, so we are all very
yes,
hopeful. We've seen
yes, the
excellent
one
videos. It's very nice
but
to see rescued animals living in such pristine conditions. Yeah.
yeah, yeah, only a fraction of the rescued animals.
Yeah.
No, but at least it's
Yeah.
a start. I would say
It is a
always
start, of
it's
course.
a start.
It's
So
an
at least
awareness.
there is a positive energy flowing, and people
Yeah.
are getting into it. And so I'm sure this will trigger a lot of other people taking it up. But more importantly, the responsible use of antibiotics. I think
Okay.
that does not require much of an effort. It just needs
Absolutely.
a change of mindset. It just
Absolutely.
needs a change of context. It just needs that we need to promote the AMR way in a big way. And that's for the veterinary sector and the human sector. Equally, both need to be targeted in the same way. And that's, I think, an important area which we need to fulfill rest. But overall, another more important, so if I have to take pick and choose a few of them, I would say responsible use of antibiotics, surveillance,
Of course.
interdisciplinary collaboration, and not to forget the most important, the community engagement and
Of
participation.
course.
So without that, without a demand, without the context that this can do harm to me and my family, we are nowhere. So once I understand that, I'm self-disciplined, because this will help me in the long run. And that understanding is the key to success in this context. And it's a nascent thing. We have to give it time. Public health
Yes.
is a long race. It's not a short
Yes.
term. Yes.
Dr. Mishra.
Yes.
Dr. Mishra, you want to add something? Anything?
No, I think it has been an excellent discussion. We got a nice feedback on the One Health program. The only thing I would like that the community is also equally responsible to be alert of this, to keep their environment clean. We don't have to wake up of cleaning our environment when there's a dengue outbreak or there's some other vector-borne disease outbreak. So I think, as you said, there should be a demand. So the community also should contribute and demand cleaner environment, but also be part of making the environment clean also. Yeah, that's about it.
So thank you for your views on the One Health program. I'm sure our viewers are more aware about the importance of human health linked with animal health and the overall environment by addressing these emerging infections and being better prepared for any future outbreaks and pandemics. Thank you, Dr. Roy. Thank you, Dr. Mishra. Thank you very
Thank you so
much.
much. Thank you so
Thank you
much.
very much. Thank you for having us on the show.
Thank you.
Thank you.